Hello everyone, my name is Vaishnavi Mahadev Vallekar. Today is a technical topic and the today's topic name is the introductions to the medical coding. The medical coding is the process of translating the healthcare diagnosis, procedures, medical services into the standardized alphanumeric codes. The codes are used for the documentations, billing, insurance purposes. It ensures that the healthcare providers are accurately for their services. Medical coding also plays a vital role in the data analysis and the improving the patient's care. Then the purpose of the medical coding. There are the different purposes of the medical coding and have this essential purposes. It includes the billing and the reimbursement. It ensures the healthcare providers receives the appropriate payments from the insurance companies and the Medicares also from the Medicaid. Then the data standardizations. It provides a universal language for the medical information, facilitating the consistent documentations across then the public health and the research. It supports the data collections for the epidemiology, then identify the trends into the healthcare. Then the legal documentations. It ensures the accurate and the complete records for the legal and the compliance purpose. Then second one, it is the types of the medical codes. Then the medical codings relies on to the various standardized code sets and the key system includes the international classification of the diseases. It is also known as the ICD systems for the medical coding. The purpose it is used to classify the diseases, conditions and the external causes of the injury. The most widely used is ICD-10 or the ICD-11 from the many regions. Then it includes the alphanumeric characters, for example E1109 for the type 2 diabetes without the complications. The second one, it is a current procedure terminology, that is a CPT. The CPT code is used for the medical procedures and the services. The American Medical Associations published the CPT all over the world. Then the codes are the 5 digits, the codes are the 5-digit codes. They contains the numbers of the 5. Then the healthcare common procedure coding system, that is the HCPCS. It is used to describe the services, equipments and the supplies which is not included into the current procedure CPT. Then it includes the level 1 equivalents to the CPT code. Then the level 2, it covers the non-physician services, for example the wheelchairs, prosthetics, etc. Then diagnosis related groups. It classifies the hospital cases into the groups for the payments and the resource allocations. Then primarily used into the inpatient settings. Then the medical coding processes. The medical coding processes involves the several steps. First one, reviewing the medical documentations. The coders analyze the patient records, including the physician notes, lab results, and other imaging reports. Then, identifying the key informations. The coder extract the relevant diagnosis, procedures, and the treatments from that data. Then, assigning the codes. Coders using the ICD, CPT or the HCPCS manuals or the softwares, they translate the medical informations into the standardized form or into the standardized codes. Then the verifications and the quality controls ensure the codes are accurate and the compliant with the player policies with the regulations. Then the importance of the accurate coding. The accurate coding is plays a crucial role, it is crucial because it minimizes the denials and delays the payment. Then it ensures the compliance with the healthcare regulations, also helps into reducing the risk of the audits or the penalties, as well as it improves the patient's care by creating the comprehensive records that can be used for the future treatments. Then the skills and the knowledge required for the medical coders. The medical coders needs to blend the technical skills, knowledge, and attention to the detail. Then the knowledge of the anatomy and the physiology. It have to understand the medical terminologies and physiology. Then the familiarity with the code sets, proficiency into the ICD, CPT, then HCPCS. Then the regulatory compliance, understanding of the healthcare laws like HIPAA and the guidelines from the organizations like CMS. Then attentions to the detail. They have to ensure the accuracy in assigning the codes and identifying the documentation gaps. Then the tools used into the medical coding. There are the various tools which is used into the medical codings to streamline their work. The coding manuals, like for the reference to the code sets, for example, ICD-10 CM, then ICD-10 CM, then the coding softwares, Optum 360 for the efficient coding, then the electronic health records, that is EHRS, the integrated systems for the accessing the patient's data, then audit and the compliance tools to ensure the accuracy and the compliance with the payer rules. Then the challenges into the medical coding. There are the various challenges into the medical coding, and the medical coding is not without the challenges. The challenges like frequent update to the code sets, for example ICD-10 to the ICD-11 transitions, then the complex pair requirements and the variations into the coverages, then managing the incomplete or the different datas, keeping up the regulatory changes and the technological advancement. Then the career opportunity into the medical coding. The medical coding offers the number of career opportunity or number of career path into the medical coding areas like hospital coding. Hospital coding focus on to the inpatient and the outpatient services. Then the professional services coding. It primarily include the physicians. Then auditing and the compliance. Review the coding accuracy and the adherence to the regulations. Then the educations and the training, teaching the new coders and the conducting the workshops. The coding have the most play a crucial role into the healthcare systems. They have the bridge between the patient's care and the financial reimbursement. They standardize the medical data. Coders ensures the efficacy and the accuracy of the data and convert it into the standardized form. Thank you.